Good day and welcome to our podcast. My name is Stephen Ulmer. I am a practitioner of traditional Chinese medicine, and I spent many years managing the oldest Chinese medicine pharmacy in Denver. And today with me, I have Michael.
My name is Michael. I'm the owner of Michael Davidev Aromatherapy. And I think today we have a podcast and you have a question for me, right?
Yeah, my question for you today, Michael, is herbal medicine completely safe because it's from nature? It's completely natural. Does that mean that it's safe?
Well, okay. No, of course, it can be unsafe. And I'm very clear on that. So, first, plants have some defenses, I can say. Like, for example, if you touch an IV or something like that, you will have a rash on your skin. I mean, the plant just protect yourself and give you what you deserve because you touch it. There's different kind of uh, product that the plant can provide, but like the Western medicine, if you abuse of it, if you go overdose, in that case, yes, it's dangerous. Interaction in between plants can be dangerous. So we are working on a chemistry. We are working on a really chemical battle in between natural elements. Plants fight every day on the ground to survive and to dominate the other on side. That's exactly what it is. A tree will grow up very high, so there's no light down and it keeps everything down, so it can grow up and be alone by himself. For the body, it's the same thing. When you use frankincense, when you use different kind of compound that are very safe, it's fine. But there are some plants like lemongrass or kind of cayenne pepper that can be a little bit irritating, or they can provide you some burning, like the cinnamon. Or so you get to be very careful. That's why, as a manufacturer, artisan manufacturer, we provide a product that is absolutely safe. We cannot say 100%, but on a range of 100% of people, they will have maybe 0.01% of people reacting on the lotion. But we work also on the external way. That means the external way is less dangerous than absorbing the plant inside your body. When you ingest something, this something is absorbed by the body and then it's inside. That's the problem is. When it's the skin, it's simple, and that's why on the precaution we told you, just try a little patch here on the part of your skin, wait like for a minute, and if you see any redness, anything, you can use it everywhere. But you got to be cautious. Plants are pure chemistry. As you say, Stephen, in the last podcast was the Western medicine use the component of plants and they mix it together, thinking that everything together will work. But then people develop some side effect. And the side effect is sometimes because one of the plants just fight against the other one inside the body, all the reaction and start to irritate your belly. It can be the same on your skin. If you massage yourself and you are a little bit sensitive to camphor or whatever, you will feel it. So yes, you have to use the plant with cautions. That's my first things. Then the second is, after talking about the potential toxicity, let's talk about the drug interaction. So, for example, if you are on blood thinner by a doctor and you already treat uh, your stress with St. John wort, you cannot use the St. John wort anymore. I mean, the blood thinner you take is absolutely contraindicated to be used with the St. John wort. Why? Because bleeding, because a lot of things. but the St. John is just a plant, like a natural plant that you dry and you can put on oil, but you cannot use it. So, yes, interaction, and that's why you have to talk to your doctor for any kind of supplement you want to take, even on external supplements. That means you can have acne, you can have everything. Sometimes by the skin, you can have a reaction with the medication you take from the inside, and that can be catastrophic. So just be aware, we are not playing a game with some toys. We are not playing game whatever. We are trying to heal, to create some kind of system that will help to release pain, to release discomfort, to give some kind of um, arrangement for the beauty lotion we are doing, like for night care lotion, facial lotion, working on wrinkles and everything. But it depends also on what you have. If you have eczema and you have a prescription medicine for eczema, before using any kind of natural remedy on the skin, just check with your doctor, check the bottle of your medication to see what interaction can be, what side effect you can have, so you're sure that you're safe. And never forget, test here. This is the best place because the skin is small. You can really do it easily. Stephen, I got a question for you. How can patients safely incorporate herbs into their medical routine?
Thank you for that question. You know, the absolute best way to protect yourself from any sort of interactions between any sort of pharmaceuticals or um, Western medicine and any sort of plant material is to consult with a licensed practitioner. I know how that sounds. I've heard it from many, many, many people like, I can't afford it. I don't know who to go to. Who do I go to? There's so many options. Who do I know is good? Who do I know is bad? I'm just going to do it myself. And I get that sentiment, but it can be very dangerous because our plants have different alkaloids, different chemicals inside of them, and they can very easily interact with pharmaceuticals. Somebody who is a licensed practitioner of herbal medicine has gone through lots of training and they understand which plants interact with which drugs. That's the safest way to do it. Again, so many people go, well, I'll just research myself. And the problem with that is especially in now in current times with AI and everything. AI wants to please you. It wants to tell you what it thinks you want to hear. So you might get wrong information. It might tell you that a plant is perfectly safe to take with a pharmaceutical when it's not. And so that's why it's really important to work closely with somebody who's licensed and somebody who has is educated and knows about these interactions. They can keep you safe.
Yeah, I agree with you. AI can be good for picture on website or whatever, but never forget the human connection with specialists, with doctors. Like, for example, um, you always talk to your primary doctor if you want to change anything. If you have a condition, as practitioner, we are not doctors. We are practitioner. We have a knowledge, but we cannot diagnose, we cannot cure. That's whatever it is. But a doctor can, of course, agree that supplement can affect and give more components for treatment if it's not unsafe, if there's no contraindication or reaction in between the two products mixed together. So it is very, very important to follow up the rules and You are alone. When you want to take something, usually you're alone in your bathroom taking your medication, and you say, "Oh, I got something wrong. Oh, I got this compliment." And you take it because you think it's good, because you saw a TV advertisement, or you saw an AI or whatever. Make sure that you read all precautions. Make sure that you know that the condition you have prescribed, prescription from a doctor, is compatible with the supplement you are on the way to take. And that's my advice. So never believe on any kind of AI or whatever. No, trust the real people. Real people are doctors, practitioners, but before practitioner, there's doctors. And the doctors will give you.
AI has no liability. It can tell you whatever it tells you, and if it harms you, it's not liable, whereas a human is, right? A licensed practitioner has that liability. On top of the fact that as a practitioner, we took an oath to do no harm. Okay. That AI didn't take that oath. It doesn't even know what that means, right? That's why it's important to see somebody who's educated, somebody who's knowledgeable on this subject, um, because they have your best interest in mind.
Thank you, Stephen.
Thank you, Michael.
Yeah, that was a good podcast too. See you next time. Enjoy the rest of your day or night, whatever. Thank you so much for following us.